Thank you, and happy WAGR Syndrome Awareness Day. I so appreciate the opportunity to talk with you. I am also the parent of a person with WAGR syndrome. And in honor of WAGR Syndrome Awareness Day, I want to talk with you about what parents of children with WAGR syndrome need to know. I believe that the more we know, the better we can help our children to grow up to be healthier and happier, and to rise to their fullest potential in life. The first thing that I want you to be aware of is that you are not alone. WAGR syndrome is very rare, but there are WAGR parents all over the world in more than 29 countries. So you are part of a global community. And thanks to help from Galena and the Center for Aniridia and WAGR syndrome, we can overcome the barriers of distance and language and come together to help each other. Like a rainbow of different shades of color, WAGR syndrome is a spectrum of different conditions, and every individual has some, but not all, of these conditions, and every individual will be affected differently. For example, 50% will have Wilms tumor, 50% will not. Aniridia, genital and urinary tract abnormalities, and developmental delays. In fact, all of the other conditions associated with WAGR syndrome are part of a spectrum. Remember that it's important to be aware of them so you can help your child if he or she has them. Just keep in mind that no child has all of them, and each child is affected differently. Genetics are the reason for the spectrum. All individuals with WAGR syndrome have a similar deletion or missing piece of chromosome 11. Nearly all are missing both the PAX6 aniridia gene and WT1, the Wilms tumor gene. But each individual can have a slightly different set of missing genes within the deletion. Some have fewer missing genes and some have more. One of the first things parents are told when their child is diagnosed with WAGR syndrome is that there is a risk for Wilms tumor. This tumor usually develops by the age of 3. Wilms tumor is highly curable if diagnosed early, so regular ultrasounds are required. One question parents ask is how long ultrasound examination should continue. This question is the subject of a lot of research. Many physicians stop regular ultrasounds at 6 to 8 years of age. However, there have been very rare cases of Wilms tumor in patients with WAGR syndrome older than this. So some form of monitoring is necessary until research can give us a definitive answer. Most parents discuss whether and how to continue monitoring for Wilms tumor with their child's doctor, and many doctors elect to continue ultrasounds or other examinations indefinitely. The most important thing for parents to know about aniridia is that their child's eyes are very sensitive and very fragile. Complications like cataracts, glaucoma, and keratopathy are common, and surgery is sometimes needed. But surgery should always wait until it is absolutely necessary. For example, cataract surgery in a typical person is usually a very simple procedure, but it's not simple at all in a patient with aniridia. The same is true for the cornea. It is very fragile. So in general, regular contact lenses should not be used. And eye infections, which are very common in all children, should be promptly treated in children with aniridia because they can become quite serious and affect the cornea. Abnormalities of the genitals are very common in both boys and girls. These tend to be obvious in boys at birth, But internal abnormalities like very small ovaries may not be found in girls until years later, when specific tests are done to look for them. One question parents often have is whether children with WAGR syndrome can grow up to have children of their own. There is not an easy answer for this. I can tell you that there are no reported cases of a person with WAGR syndrome having a child of their own. This may be because genital abnormalities make pregnancy less likely, or because people with WAGR syndrome tend to have intellectual disabilities and therefore may be less likely to marry or to have sexual partners, or it could be a combination of factors. Intellectual disability is very common in people with WAGR syndrome, but here again, there is a wide range of possibility. Some individuals are profoundly affected, and very few have normal or near normal intellectual ability, but most will fall somewhere in the middle. The most important thing for parents to know is that every child with WAGR syndrome can learn. And like all of us, they continue to learn all their lives. So when it comes to education, shoot for the moon. Assume that your child has great potential and make sure she or he has every opportunity and all the assistance they need to discover that potential. Behavior problems are extremely common in children with WAGR syndrome. Tantrums and aggression can be incredibly hard to deal with, and sometimes parents can feel ashamed or frustrated or worried. Again, you need to know that you and your child are not alone. No matter how difficult your child may be sometimes, there are other kids with WAGR syndrome who've been worse, and also other WAGR parents who've helped their children overcome these issues. So here's what you need to know. Behavior problems in WAGR syndrome can have a variety of causes. These causes can include autism, auditory processing disorder, sensory integration disorder, and anxiety disorder. Some children have one of these problems, other children have several of them. The best way for parents to solve these problems is by learning more about them. What are the symptoms and what are the treatments? Galina and the Center for Aniridia and WAGR syndrome will be sharing some answers with you soon. You'll also be able to find more information on the WAGR.org website. One of the genes that is sometimes missing in the WAGR genetic deletion is called the BDNF gene. The BDNF gene controls appetite. So people who are missing this gene can be very overweight, even at a young age. About 50% of people with WAGR syndrome are missing this gene. The problem is that they never feel full, even after eating a big meal. For some people, this means that they will eat and eat and eat until there is no food left in sight. For these children, locking the refrigerator and the pantry may be necessary. For most with BDNF deletion, it can be helpful to talk with a dietitian or a nutritionist to make sure your child is eating the right amount of healthy foods and getting a normal amount of exercise. Unfortunately, even with all of these measures, some people with WAGR syndrome and BDNF gene deletion are still overweight. What parents need to know is that it's still very important to manage your child's diet and exercise, because doing so will always have a very positive effect on their health. Chronic kidney disease is another condition that is part of the spectrum of WAGR syndrome. And like the other conditions, early diagnosis and treatment can make a big difference. Diagnosis involves monitoring the urine for abnormal levels of protein and regular blood pressure screening. If either of these are elevated, there are medications that can reduce them. And these medications can slow down, or in some cases, even prevent the need for a kidney transplant later on. As you are probably aware, the spectrum of WAGR syndrome can include a whole variety of conditions. To find out more about how to help your child, consider taking a look at the website of the International WAGR Syndrome Association. While the automated translation tool for Russian is not perfect, it's a start, and the WAGR.org website is a good place to find both information and support. And finally, as parents, we all need to be aware that research is the key to our children's hope for the future. And the good news is you can help make it happen. By enrolling your child in the WAGR Syndrome Patient Registry, you can help researchers to find answers for our children, answers that will help them to have that bright and beautiful future we all dream of for them. Thank you again, and happy WAGR Syndrome Awareness Day.